Information for parents. Arm yourself with knowledge to support young people in preventing or delaying use of alcohol, tobacco, and other drugs. Being there for young people will help prevent the harm caused by these substances.
See this quick 7-minute video to improve your knowledge.
Young people use substances for 5 main reasons: experimental, recreational, situational, intensive, and dependent. Some of the commonly used substances are marijuana, alcohol, tobacco, caffeine, vapes, heroin, LSD, ecstasy, cocaine, ice, mushrooms, steroids, and pharmaceutical drugs. Marijuana is also known as MJ, Mary Jane, Green Dragon, 420. Some common side effects can be balance problems, rapid heart rate, red dry eyes, slower reflexes. Some long-term effects can be dependency, lower sperm count, suicidal thoughts, and irregular periods. Alcohol, commonly known as booze or grog, can have side effects such as increased risk of accidents, injuries, and hangover. Some long-term effects of consuming alcohol can be heart diseases, liver diseases, mental illness, and brain damage. Tobacco is also referred to as ciggies, darts, rollies, smokes. Some adverse effects of tobacco can be cancer, heart disease, stroke, diabetes, eye disease, COPD, which is a pulmonary disease, low sperm count, rheumatoid arthritis, immune disease problems, and increased risk of tuberculosis. Vapes, commonly known as vaping, Juul, pods, green cig, or e-hookah, can have adverse effects such as addiction, anxiety, depression, becoming a smoker. It affects the brain development, it can cause lung damage, and can affect your sleep patterns. Heroin, commonly known as junk, smack, brown, horse, Harry and boy, can have some side effects such as confusion, drowsiness, slurred speech, slow breathing and heartbeat, tiny pupils. It can have some long-term effects such as dependency, intense sadness, dental issues, infertility, and irregular periods. Ecstasy, also known as MDMA, MDA, MDEA, pills, love doves, or ickies, can have some side effects such as large pupils, grinding teeth, nausea and vomiting, panic attacks, and paranoia. It can also have some long-term effects such as depression, high blood pressure, liver problems, memory problems, and cracked teeth from clenching. Cocaine, commonly known as crack, Charlie, coke, rock, snow, dust, or yayo, has some side effects such as anxiety, paranoia, agitation, indifference to pain, increased sex drive. It can have some long-term effects such as kidney failure, stroke, seizure, sexual dysfunction, and heart disease. LSD, commonly known as acid, blotter, dots, tab, Lucy, trips, or window, has some side effects such as dilation of pupils, euphoria, vomiting, auditory hallucinations, and facial flushes. It can also have some long-term effects such as flashbacks or visual distortions, schizophrenia, and dependence. Ice, commonly known as crystal meth, shabu, glass, tina, frosty, or shard, has some side effects such as excessive sweating, increased sex drive, teeth grinding, fast heart rate, and dry mouth. It can also have some long-term effects such as restless sleep, muscle stiffness, stroke, depression, and regular flu. Magic mushrooms, commonly known as shrooms, mushies, blue, meanies, golden tops, liberty caps, can have some side effects such as euphoria, change in consciousness, stomach discomfort, vomiting, facial flushes. They can also have some long-term effects such as anxiety, intense hallucinations, muscle weakness, and seizures. Caffeine can also have some side effects such as excitability, dizziness, higher body temperature, headache, faster heart rate. They can also have some long-term effects such as anxiety, ulcers, osteoporosis, muscle tremor, and confusion. Steroids, also known as roids, gear, juice, stackers, gym candy, Arnold's, pumpers, weight trainers, can have some side effects such as water retention, acne, increased sex drive, sleeping difficulties, and mood swings. They can also have long-term effects of liver damage, prostate cancer, ligament damage, and depression. Pharmaceutical drugs. They can have some side effects such as constipation, drowsiness, insomnia, dry mouth, skin rash. They can also have some long-term effects such as suicidal thoughts, abnormal heart rhythms, internal bleeding, and cancer.
To help young people, it's really important that we get our facts right. Some common facts are, as per 2017, 12 years and older kids smoked more than 93 cigarettes a week. Not all drugs are illegal. Experimental use does not always lead to regular drug use. And the legal age for alcohol consumption is 18 years. Thank you for patiently listening. For tips on how to talk to young people, kindly explore more resources on our website www.mhub.org.au. Thank you.